Midwives in Ontario are telling the government they want to offer more services, including abortion services, but they've yet to receive the go-ahead. So for more on this now, the president of the Association of Ontario Midwives, Elizabeth Brandeis, joins us here in studio. Thank you for coming in today.
Good morning.
Let's start with exactly what it is your association is asking for.
Yeah, so the conversation that we're involved in right now is thinking about ways that midwives can provide services and fill gaps in the healthcare system around reproductive healthcare generally. We know that midwives are very aligned with providing a whole range of reproductive healthcare options that are currently not in our model of care.
I know that midwives in other countries are able to perform abortions, and I gather here in Canada what you're hoping for, and starting with Ontario in your case, is the ability especially to bring care to rural areas. Is that part of why you feel this is urgent?
Yes, absolutely. The issue of access to care, so in all manner of health care, but for abortion services in particular, we know that the precarious areas that don't have access to safe abortion services are often the rural and remote areas in the country.
Let's talk a little bit about what midwives are able to do now and what would have to happen for this to take place. Some people might be surprised to know that midwives can prescribe some medications, and I gather one of the things you would be asking for is the ability to prescribe what's known as it's an abortion pill. A medical abortion is what it's called. And would that be the first step before you could even do this?
Absolutely. That's really the only barrier at the moment in terms of the drug regulation. We do have a certain list of drugs that we're able to provide in the provision of pregnancy, birth, and postpartum care. And so the expansion of being able to provide mifegammiso is the extended drug regulation that we would be looking for.
And how do you get the okay to do that?
So it's part of a broader conversation that we're engaged in with the ministry right now to think about how to be as responsive as we possibly as we can be to the needs of our clients and communities.
So you're hoping that they will come on side with your argument. Let's take a look at what Ontario's Health Minister Eric Hoskins has had to say on this so far. He has said, we are not currently considering expanding the scope to include abortion services. This would require a significant amount of work. And although we are open to all discussions, it's not currently an activity the ministry is undertaking. He's also said it's not really a priority. What's your reaction to his statement?
Yeah, we're very interested in continuing to engage in that discussion, both with government and with communities, to figure out where the need is and what the options could be for that expansion. We know regulatorily there really are very few barriers to midwives being able to roll this out. So we see the drug regulation as one small step in that right direction.
Part of what a midwife does is become a companion caregiver through the process of a pregnancy into delivery. And there's a unique bond, I know, that's formed there. In the case of an abortion, would you be looking at a similar sort of a longer-term relationship?
Absolutely. One of the interesting parts of the conversation about midwives moving into that space is about a model of care or a style of care with that continuity and relationship from counseling through the procedure and to post-procedure care as well. We know that midwives are very well situated to develop those relationships and help guide clients through that experience.
Final question for you. I know one of the many hats you wear is that of a teacher at Ryerson University in the midwife program. So you're dealing with young people whose calling is to become a midwife. And the definition of a midwife is it would be someone who works with a woman throughout a pregnancy to bring a successful baby delivery of a pregnancy to full term at the end. And abortion seems to be the other scale of that spectrum. Are you hearing from some midwives or some of your students who say that's not what I'm in this for, I don't want to do that?
Really one of the very core tenets of midwifery is around choice. And so we feel that this expansion into abortion provision is exactly aligned with that very principle of guiding, having the client guide the care based on their choices. So we see that as very aligned with the model that we currently provide.
But I'm guessing there must be some midwives who wouldn't want to do this, but of course it would be a matter of their own choice.
Of course, any provider has that option to opt out.
All right, interesting conversation. Thanks for coming in and telling us more about it.
Thank you for your interest.
Elizabeth Brandeis is from the Association of Ontario Midwives.